We've all heard the phrase used, iliotibial band syndrome, or IT band syndrome. That presents with pain that stays at the lateral side of the thigh. Well, honestly, the iliotibial band is just an extension of our three-dimensional fascial matrix. It itself does not cause or create pain. It is often either referred pain from higher up in the gluteus minimus muscle, or it is because there are trigger points within the Vastus Lateralis muscle, which is one of the 4 quad muscles or thigh muscles that runs to the lateral outside edge of the thigh. To treat the trigger points, we've all heard of foam rolling the IT band. Well, what we advocate is trigger point pressure release. So you can certainly use, this is the tiger tail roller, or we can use a static compression tool like the tiger tail curveball, or we can even use a 5-inch Fitball right there to the side edge of the thigh. To apply trigger point pressure release to the vastus lateralis, we want to hold for 10, 12, 15 seconds, scooch ourselves up, and repeat. We can also apply this pressure while the leg is on the stretch. So we can bring the heel up, hold the heel with our opposite hand, if you can see that here, and then we apply pressure while we balance. This is also a good workout for the arm and shoulder. To stretch the vastus lateralis, it would be the same as we would stretch the rest of the quad muscles, and we would bring the leg across our butt, reach with the opposite hand, and bring the heel to the buttocks. Push away, hold that for 10 to 12 seconds, breathe in, coordinate the exhale, and relax and further stretch. There's some helpful hints brought to you by the Chicago Center for Myofascial Pain Relief.